Hello, everyone. Good afternoon from Singapore. Good day, good evening, wherever you are in planet Earth. I'm Dr. Renzo Guinto, Associate Professor and lead of the Planetary Health Program of the SingHealth Duke-NUS Global Health Institute here in Singapore. And again, welcome to our new episode of Conversations in Planetary Health. In this series, we tackle a wide range of topics that are at the nexus, the intersection between the health of people, our health, and that of the planet. And we also host leaders, scholars, experts from across Asia and beyond who are working on these various topics that are of interest to our group and that need to be addressed in this day and age. So, again, thank you for joining us. And our topic for today, this afternoon, is environmental sustainability in health technology assessments. How do we redefine value in healthcare? And to unpack, this topic, we are very privileged to have with us our friend and colleague and collaborator from HITAP, in Thailand. He is the lead for the Environmental Economics Unit. He's actually here in Singapore for another conference, but he was so gracious enough to drop by Duke-NUS to deliver, this presentation, to share his knowledge with us and engage in meaningful conversation. What will happen is we'll listen to him for around 30 minutes, and then we'll spend the second half of this hour to have a discussion, for you to ask questions both to the people in this room and also to our participants joining us via Zoom. So without further ado, let's give a warm welcome, a big hand to Sarin KC. Sarin, welcome to Duke-NUS. Thank you.
Thank you, Renzo. Pleasure to be here. My first time here in Duke-NUS. And thank you for organizing and inviting me to deliver this talk, both of you, Tanisha and Renzo, and your whole team at SingHealth Duke-NUS. Also, thank you to all the participants who are giving up their time to join this conversation. So, as Renzo mentioned, I'm from HITAP. HITAP stands for Health Intervention and Technology Assessment Program, which is the HTA agency in Thailand, and currently leading the Environmental Economics Unit. So today, going to talk about three things: why we should think about environmental sustainability in health technology assessment, how we can start thinking about incorporating or managing environmental impacts of health technologies, and what is the role of Green HTA. So these are three big topics that I would like to cover. Before I begin, maybe there's a lot of people in the chat would love to know what your academic or professional backgrounds are. So if you want to type it in quickly, that'd be great to see so that I can see what your backgrounds are.
And maybe while we're waiting for our friends online to, make notes, we can also ask the people in the room.
Yeah.
Yep. Just say quickly your background, your profession, your discipline. Yep.
Okay.
No need full introductions. Very quickly.
Graduate student.
Graduate student,
Public policy.
public policy.
I'm in board secretariat, but have an interest in sustainability in healthcare.
Great.
Climate and Health Geography.
Environmental studies.
Planetary Health.
Biggest one.
And okay, let's see in the Q&A. Our chat is disabled, but we're seeing some using the chat box: infectious diseases, communicable diseases, systematic review methodology.
Okay. So a lot of folks from the public health background, and few from the climate science and environment as well. I also recognize few of them are physicians, at least in the past, and some also present. So a good mix. So why should we care about environmental sustainability in health technology assessment? So to deliver this point, I would like to illustrate this with an example. And the example comes from anesthesia. During surgeries, doctors use anesthesia to get the patients to deliver the treatment. And doctors, physicians usually have two options, sevoflurane and desflurane. So these are the two choices of anesthetic gases that are available. Now let's look at the health impact or the effectiveness of these two interventions. According to the literature, their effectiveness are comparable. The only difference between sevoflurane and desflurane is that desflurane is perceived to have faster onset for the patients. And this is the primary reason why physicians prefer to use desflurane. Not because it has better health outcomes, primarily only because it has faster onset. What about the cost? Sevoflurane is almost twice as cheaper compared to desflurane, right? Now, primarily for health economics or universal health coverage, value for money comprises only health and cost. But what we are trying to advocate for is the value metrics should be broadened to consider environmental considerations. So when you do that, what happens? As a proxy, we're looking at global warming potential, and the global warming potential of desflurane is 10 times higher than that of sevoflurane, right? So it's quite different, the impacts in terms of cost as well as environment, but in terms of health, it's comparable. So people in the room as well as people on the chat, feel free, because I'm going to ask you a question. If you were a decision maker, either at the hospital as a physician or at a decision maker at Ministry of Public Health, what would you choose, sevoflurane or desflurane? People online can put it in the chat, and people here present maybe can just raise their hand and say which one you prefer. Okay, maybe sevoflurane, raise your hand. Desflurane, anyone? No one, right? On the chat,
Sevo.
Zero, right? Okay, so pretty clear winner, right? And this is what we call in health economics a classic case of low value care. Low value care because it delivers the same health outcome, but at a much higher price, both in terms of economic cost, but also environmental damage. And the lesson here is this can actually be prevented, right? We needn't use desflurane in the hospitals when alternatives are available, which can do the same job. Now, to take this example a bit further, I would like to show you what is the impact of switching from desflurane to sevoflurane. And this is just a tiny example from a very small department in Australia. So they've decided that they want to, maybe I'll use a pointer. Yep. Okay, so they've decided to switch from desflurane to sevoflurane, and you can see the total volume reducing because sevoflurane in low dose can do the same amount of work in high dose of desflurane. So the total volume is decreasing. Next, what happens to the cost? The cost is plummeting, right? The cost of desflurane, as you saw earlier, is quite expensive. So switching provides you with cost reductions and economic savings. What happens to the carbon emissions? The same trajectory, right? A massive drop in carbon emissions just by switching one gas inside your clinical practice. So I hope I've made the point that pretty clear that we need to consider broader values in health technologies assessment, going much beyond just costs and health outcomes. So how? The next question is then how do we do it? So this is the new framework that we've been working on, and this is the only second time that we're presenting. So bear with us. From our perspective, there are 3 gates at which we can try to address, manage, or reduce environmental impacts of health technologies. And the length of the gate as you're seeing here, indicates the barrier to entry of health technologies into the market. And there are three stages. So the first stage, or the first gate, is market authorization. So this is when the products have been conceptualized, gone through R&D, receive approval from FDA, and then now is ready to enter the market. The second gate is when the product has received market authorization, but now is wanting to be reimbursed by the National Health Insurance Agency. So that's when the HTA agency come into play. The final gate is clinical transformation. For example, how the product is being used in the clinical setting. So from our perspective, these are the three gates or three stages when we can address health, environmental impacts. So what are they? The first is what we call prevention or ex ante. Anything that you do before the product receives market authorization is trying to prevent the technologies that have high environmental impact from entering the market. And as you can see, the size of the box indicates the potential for environmental savings. So the savings that you can have before market authorization is huge. And the gate to entry is also large. But what happens after the entry is crossed beyond market authorization? We call this stage damage control or ex post one. The product is already into the market. The barrier to entry is low, and the potential for saving, environmental savings is also reduced. And what happens when the product has received a reimbursement decision? This is what we call last resort or ex post two. So this stage is most of the damage has already been done. As you saw in the case of the anesthetic gases, they're already into clinical practice. They're already contributing to global warming potential and last resort. And as you can see, the environmental savings is also quite low. Now, taking this framework one step further, what are the details inside and how we can use them to reduce environmental burden? So the first, majority of you might already be familiar with environmental risk assessment or environmental impact assessment. So these are a standard procedure for assessing what is the potential impact of any materials or any ingredients, not just medtech, but any products that are being put into the market. The reason we put it here is we're finding from our review that many countries actually don't have a clear decision tree to decide whether something needs to go under assessment. There also lacks a clear threshold to say that this product or this material or this ingredient is good or bad. There are clear guidelines in high-income countries and regions like the European Union, but we find that is not the case in our parts of the world. So we're advocating for the use of environmental risk assessment in the market authorization stage, so to prevent harmful products entering into the market. Second is the role of early HTA. Again, I'm not sure the audience, but HTA stands for Health Technology Assessment. Its primary role is to inform the health insurance body or the Ministry of Public Health to say whether a medical technology or a device or a vaccine or a drug is good value for money or not. Good value for money, as I mentioned earlier, has two components: the economic cost and the health outcome. So early HTA is a new concept that is trying to work with the industry to manufacture products that have high potential of being cost effective and delivering good value for money, even before the product has been conceptualized or been developed. What we're advocating here is to use early HTA to design products that comply with the environmental risk assessment. So as you can see, anything that happens before market authorization is preventing and also yielding the largest environmental savings. We recently did some work, and there was a new definition of early HTA that was published, and we were fortunate enough to be invited to write what are the implications of incorporating environmental sustainability and early HTA. So for those of you interested, please feel free to read our paper. We talk a bit more detail there. The third thing that we can do is a bit late because the product has already entered the market now. But what we can do is look at pharmacovigilance. This is, again, a standard procedure in the medical field. The different thing that we're proposing is now we're calling for eco-pharmacovigilance. So you not only monitor the side effects of medicine, but we also monitor the side effects to the planet and our environment. And in particular, we advocate for monitoring and evaluating products, especially those who have high uncertainty during the ERA stage before market authorization. The last is the role of HTA. The role of HTA, as mentioned earlier, which medical product is cost effective, looking at cost and health outcome. What we're advocating for is green HTA now. That redefines the value. The value is not only economic cost and health outcome, it is also the health of the planet. So green HTA hopefully allows us to choose products that offer best value considering all these three important aspects. But green HTA doesn't stop there. The first role of green HTA is telling which medical good should be reimbursed, right? And the second role of green HTA is if the product has already been reimbursed, for example, or used in the clinical setting, as you saw the case of Desflurane. Green HTA can help us identify which of the products that are already being used in clinical setting are either low value or harmful value. And the purpose would be to first identify them, either remove them or reduce them to have economic as well as environmental savings. So that is the how we can try to manage and reduce environmental impact of health technologies in our settings. Then the next question is, what is green HTA? So green HTA, again, I'm repeating this again and again and again, because HTA, in the traditional HTA, the definition of value is what is the cost and what is the benefit from health technology. And this is what we call traditional HTA. What we're advocating for green HTA is to extend this concept of value to add the environmental impacts of those technologies into our value definition. And that is green HTA. So how can we go and do green HTA? There are three key steps that we can undertake. The first is you need to measure the environmental impacts of individual health technologies. And for that, we rely on existing databases, for example, the database for healthcare environmental impact, Healthcare LCA, which provide proxies for environmental impact of single or individual health technologies in terms of their carbon emissions. Second is we need to be able to convert these environmental impacts into something that can be used by health economists. For example, if you look at carbon emission, you can try to convert the carbon emissions into economic costs. And again, there are guidances on how you can do that. So there was a paper that was published in Nature on the social cost of carbon emission. And I think the price is around $165 per metric ton of carbon emission. And this number has been updated to reflect the true costs of carbon to the society. The previous disagreements in the field of not using a social cost of carbon was the cost was too low, and that would not truly reflect. So this is the revised number that we're proposing to use. And then the last step would be to conduct your standard economic evaluation or HTA modeling, where you would treat the additional carbon cost as an additional cost parameter in your economic modeling. I would like to highlight that we're only using carbon emission as one of the proxies for environmental impact. Many of us here come from climate and environmental background, and we know carbon emission is not the only environmental impact indicator. There are a host of other things. We're choosing carbon emission just to provide an example. Next, I would like to share a study that we are testing the feasibility of conducting green HTA. And the case study is about dialysis. There are 3 interventions that are currently in place in Thailand, and we're trying to assess the environmental impact of these dialysis options. So the results are preliminary, and the results, as I shared here, there are 3 steps. So the results only come from step 1. After the step 1 is complete, then we'll proceed to step 2 and 3. Before I share the results, I would like to acknowledge my team members. A few of them are from HITAB, a couple of them are from local universities in Thailand, and a few are from our nephrologists who deliver dialysis to patients. So these are our project members. So project detail, interventions, dialysis, there's 2 key types of dialysis. The first one is hemodialysis. The second one is peritoneal dialysis. Within peritoneal dialysis, there are 2 options, CAPD or APD. CAPD is manual, APD is automated. The scope of assessing the environmental impact is cradle to grave. So for those who are not familiar with this terminology, we're basically saying we're trying to assess the environmental impact from the point of raw mineral extraction all the way to manufacturing, transportation, use in hospital, and waste disposal. So the entire life cycle. The functional unit is meaning what is the impact, environmental impact we're trying to assess is for 1 dialysis session per patient. The model that we've used is life cycle assessment, recipe 2016 model. The data comes from 5 different dialysis centers, differing in size as well as their functionality across Thailand, 130 patients. We also collected raw data from manufacturer, the biggest dialysis manufacturer in Thailand, as well as working with the Thailand Central Medical Waste Body to extract the waste data. So here are the results. Again, preliminary results. There might be a few changes once we do some further analysis. So here, HD hemodialysis is the clear loser. Right? You can see it's peaking above everything else. Around 60 kg carbon emission equivalent per session per patient, whereas APD and CAPD are just hovering around 10. In this graph, you can also see the composition of the factors that are contributing to the carbon emission. And you can see medicine, chemicals, consumables, electricity, water are some of the key hotspots contributing to this carbon emission. Now, you might think that 60 kg, 13 kg, and 7 kg is not a lot, right? It's not a lot. Why are you so concerned about like 60 kg of carbon emission? Now, I would like to remind you that this figure is per session per patient, right? What happens if you look at the total number of patients for the entire year? The figures change very quickly. For HD, it's 1.5 billion carbon emissions kg equivalent, right? And that is a number that is very difficult to fathom. And for CAPD, APD, the number is still large, but when you compare it to HD, it's nothing, right? And for lay people, what does 1.5 billion kg carbon emission equate to? It equates to powering around 300,000 home the whole year, right? And that is quite significant. And just to remind you again, this is only from 1 treatment, right? This is happening across all the other treatments that the healthcare or the health sector is providing. So the impact can be quite large. So going beyond carbon emission, there are other environmental impacts, as I mentioned earlier, and let's see how they pan out. The impact on species loss. Again, HD is a clear loser. And again, you might think that only 6 species lost to get a good dialysis. So not too bad, right? But think about these cute pandas, right? We all love them. Like, we don't want them to go extinct. So, but still, the third metric that we can show the environmental impact is the resources lost, and you can monetize these figures. And again, HD is a clear loser. However, you saw so carbon emission, species loss, resources, HD is bad, bad, bad. But when you talk about DALIs, if you convert the environmental impact of these interventions and convert it into effect on human health, the impact is reversed. Now the PD, the peritoneal dialysis, which is CAPD and APD, much worse than HD. So it's not always the case that one indicator, carbon emission, if carbon emission is bad from this product, it is also going to be bad for all the other indicators. That's not the case. And this is one of the biggest surprises personally from me from this project. And this led to many questions in my head, how we can actually use this information, and is it going to confuse stakeholders, right? So these are 3 metrics that we can show in addition to carbon emission. But as mentioned earlier, life cycle assessment gives you 18 other metrics that you can use. And as you can see from this figure, for majority of these metrics, PD is actually doing much better than HD. But there are 3 indicators that are for which PD is worse. And I guess it depends on who you ask, right? Who you ask, what is important to them might vary, right? One policymaker might say, yeah, carbon emission is the only thing that we should worry about. But another one might come and turn around and say freshwater marine ecotoxicity is equally important, or maybe more important, right? We don't know. So when we started this project, we thought carbon emission is a good proxy for environmental impact. But looking at this table, this might not be a straightforward answer. And that we might need to look at the details and see what is more important to us and also the decision makers before we can make a conclusive decision. Nonetheless, if decision makers do say that the carbon emission is the most important indicator, then we did a quick analysis to see what happens if we switch from HD to PD. And as you can see, this is only looking at the data from a monthly new registrants into the dialysis, and there's a 36% reduction in carbon emission from reducing the patients from HD to increasing the patients to PD. So there's a clear win situation here. And for those without the context, HD is also extremely expensive to patients as well as to healthcare system. It is also inaccessible, meaning it has equity concerns. For HD, people need to go to the dialysis center, whereas PD, it can be delivered to home, regardless of where you are, and patients can do it very easily. So considering many things, economic costs, health outcome, environmental equity, it seems like PD is a better choice if you look at carbon emission. So question to the audience and the question to myself and my team, is green HTA the answer to our problem? Maybe not, probably not. But we think it is useful because it provides you with a lot of information regarding the environmental impact of individual health technologies. Like mentioned earlier, it can show you the aggregate, but also the details inside. So you can see, even if you have to deliver that health technology, can you find a way to reduce the impact, the hotspots, right? Which can you change the way it's delivered, the way it is delivered to patients? Can you find a more sustainable way to deliver? MCDA, I'm not sure if people are familiar with. So HDA has one single output, which is ICER, looking at the difference in cost and then the difference in outcome. And then the decision maker uses this number to say yes or no to a health technology. But MCDA it does not use only that figure, but it uses multi-criteria decision making system. So the 17 or 18 impact categories that we highlighted earlier can be used in a multi-criteria decision-making area. And it allows different stakeholders to prioritize different impact categories and give different weights to make a decision. Again, there are many things that you can do with this information, and we're really excited to see how the results change when you use one indicator versus the other. Again, Green HTA may not be a simple answer for many reasons, and one of the reasons is there might be trade-offs. The example that I shared with you earlier was very curated, so that you would make a decision with me to choose sevoflurane instead of desflurane, right? Desflurane is a clear loser here. What I didn't show you is that physicians also have another option, and that option is isoflurane. Here, there is no clear winner between isoflurane and sevoflurane. Here you can see isoflurane is so much cheaper than sevoflurane, right? But the environmental impact in terms of global warming potential is quite large. So in this case, what do, right? Do you value economic savings, or do you value environmental impact savings? This is still achievable. What is even more difficult to achieve is, what if there is a trade-off between environment and health, right? Think of you as an individual when you go to the hospital. Do you really care about carbon savings when your head is about to burst with headache, or like, you need a surgery? It's a very difficult question, right? So we are also trying to fathom this question and trying to understand from different perspectives, how would one prioritize when faced with these kind of trade-offs? So to help get some answers, as I mentioned, we don't have all the answers yet, but we do have a group of people who are working on this issue. Many of you who are in the HTA field may be familiar with HTAI. It's a global network of HTA agencies, and we've established a working group called Environmental Sustainability in Health Technology Assessment, or ESHTA for short. There are 3 working groups. The first is we're trying to define what does it mean to include environmental sustainability into HTA, because right now there isn't any consensus. The second thing we're trying to define is what should we prioritize, what should be considered, and what shouldn't be considered. So what is the scope of HTA in trying to address environmental sustainability? And then the third, more difficult question is, what are the methods? What are the appropriate methods for us to allow to do this? And are they appropriate? Do we need to come up with new methods? So 3 working groups, and the third working group, which I'm co-chairing, is accepting case studies from you. If you have had similar analysis done in the past on incorporating environmental impacts of health technologies, then please feel free to scan the QR code and share safe case studies, or just feel free to message me. So last 2 slides. First, I'll do the key message, and then I'll do a quick promo of our work. First message is every little effort counts, as we showed you during the framework. So before market authorization, reimbursement, and clinical practice, anything that you do in those stages helps. And trying to address environmental impacts of health technologies does not fall only within the health sector. It is a multi-sectoral issue, and we have to use many as possible leverage points to make our case and make impact. The third, green HTA hopefully can help. We believe it can help, and let's see if it actually can in practice. The last is the problem. First, there's a lot of lack of consensus on whether and how we should do this. The second, even bigger, is the capacity of, first, the people who actually use this information, the policymakers, may not be aware, maybe don't even care, or don't know that they should care, right? And even more importantly, the researchers, like people who have to do analysis like LCA. It's a new area for people who are working in the health sector. So there's a lot of gap in capacity that we need to fill. Last slide is our team has developed this very small interactive educational game on carbon footprinting, individual daily lifestyle, and also suggest alternatives that you can take. And if your total emission is lower, then you get to be free. If it's higher than the average, then there's a bear ready to spank you. So be careful. So please feel free to scan the QR code to play the game. It's very simple. And during your lectures and your colleagues, please feel free to promote. It's free. It is bilingual. So I'll stop my talk there. Over to you, Renzo.
Well, let's give Sarin a big hand. Thank you so much. Such an elegant lecture. That's how I would like to describe your presentation. But also, thank you for introducing to us this, young yet rapidly evolving space of green HTA, or another phrase that we were using was incorporating environmental sustainability in HTA in health technology assessments. While I'm waiting for questions, and we have around 20 minutes, question maybe from the room, and I'm seeing a few questions from Zoom. I think some quick reflections. Yes, we now have this new tool, which is in its nascent phase. You're inviting scholars, researchers from various disciplines, not just the economists, not just the environmental scientists, but also even the clinicians, right, who are the ones using these technologies, prescribing these products, etc., need to be involved in this, right? And actually, one field that I thought should also be involved is ethicists, right? Because maybe one question is, okay, we're now in this pursuit to decarbonize our healthcare systems, but when we face challenges or dilemmas, when it's becoming the environment versus the patient, right? Which should be considered first? And of course, someone who's coming from the medical profession will say the patient first, right? Human lives and carbon and and other environmental concerns will be secondary. Although now, I'm sure when we are undergoing a procedure or delivering one, you'll remember the panda, you'll remember the other creatures, great and small, but also will remember also our patients who are affected by climate change. In a way, it's a bit cyclical, right? We save patients, but we're also emitting carbon, which then exacerbates the climate crisis, among others. But also, I think one reflection is that, yes, this is one potentially powerful tool, but then we need to look at this from a broader perspective. You gave us, this suite of tools, right? Eco-pharmacovigilance, new term, and even using existing tools from environmental health sciences, ERA, environmental risk assessment. But also, it's not just about the products, but should we be decarbonizing the energy system to which the hemodialysis is plugged to, right? I think when we have big questions regarding specific products, then we need to take a step back and how's the energy system? How's the design of the hospital building, etc.? And maybe there are ways to decarbonize while not sacrificing patient care. So those are just some initial insights from my side, and I'm seeing some questions, but I'll give the first chance from the room if there's any burning question, because we're like, trying to survive climate change. I'm not seeing any hands, so let me just read a question here, and some are very specific. I'll try to also combine. There's one interesting question. In a way, maybe hemodialysis is one example, but maybe there are other examples. How about the carbon or environmental impact of care pathways?
Yeah.
Right?
Yeah.
Because sometimes we're just laser focused on the product.
Yeah.
But then, and you alluded to the life cycle of the product.
Yeah.
But how about the entire pathway of care?
Yeah.
Hmm.
Fantastic question.
Yep. I'm rephrasing some of the questions, so just
yeah.
answer.
Yeah, no, fantastic question. And whoever is asking this question should come and work with us.
Yep. So he's also recruiting in high top.
Yeah. Actually, I was speaking with Renzo. I had a meeting earlier this week with a few people who are also working in this space. And one of the things that we're trying to do is trying to look at the environmental impact of the entire care pathway that you were talking about. But that, for us to do that, you need to know the impact of individual products, right? Then only you can see the impact of the whole care pathway. And the idea is to empower clinicians to see if you did X number of tests and if you did X number of drugs on this patient, or if you did this surgery, that surgery, what would be the impact? Not compromising health. So this tool is in discussion and in development, and hopefully next time I'm here, I'll be able to share more.
Great. I have also a list of questions from the registrants who, gave advanced questions. And one is in relation to the carbon footprint of AI. There's a lot of AI now being used for healthcare purposes.
Right.
Where are we in the application of green HTA, even for digital health AI types of healthcare technologies?
Right. Yeah, it's an important question that everyone's been asking, like the carbon emissions, the energy requirements of AI and machine learning tools, right? Like super high. But for that question, I have one thought very similar to you.
Mm-hmm.
The AI and machine learning in itself do not have any environmental impact. The impact comes from the use of energy, right? So then the question is, can we decarbonize the energy system? Right? The AI is in itself not a problem. What it's using to deliver the output is the problem, right? And for that, it's a different question, like addressing the energy question.
Right. And maybe another question related to AI is, can AI help us be better in doing green HTA? So it's the other way around, right? Yeah. Can AI accelerate the expansion, the spread of, and not just green HTA, but the incorporation of environmental sustainability in healthcare decision making?
Yeah, hopefully AI will get there where we can do robust analysis in a timely manner. And my fourth point is about capacity, right? Capacity of researchers, and the life cycle assessment studies can be very time consuming. They're from technical point of view, they're not very difficult to do, but in terms of time, it's very detailed. So if there are AI tools in the future that can help us compress the time needed to do this, that would be amazing.
Right. And if we can use these technologies to a bit unburden the provider and the patient. Yeah. You mentioned a while ago, if you had a headache, you'll not think about carbon first and foremost. But if there's already a system and a resource existing that is within the reach of our decision makers, providers, patients, then it will be easier to green the healthcare system and the services without that even additional cognitive burden of thinking about it.
For sure.
And I'm waiting for questions from inside the room. But while I'm doing that, you mentioned that there are not many people trained in this space. I mean, you are self-learned in a way, right? You're developing this field within HITAP. But for those who are interested to learn more, to receive training, what are some opportunities, programs that exist not only in Thailand, but across the world?
Right. Well, one is you, the thing of Duke-NUS, right?
Or listen to this webinar, right? I mean, we're recording this, by the way, and we'll make this available online.
I mean, your team is a pioneer in planetary health, right? So that's a big space to improve the knowledge. The second is the Center for Sustainable Medicine here at NUS. They're also pioneering some carbon emissions work. In Thailand, yeah, we're doing regular webinars on the impact of climate change on health, but also the impact of the health sector on climate. So we look at both sides. So yeah, keep an eye out. Hopefully we'll come to a point where we can deliver technical trainings.
Right.
Yeah.
Yep. And now you're giving me an idea for our Planetary Health course in April 2026. Maybe we should include a session on incorporating environment into healthcare decision making. There's one question from one of the advanced questions. Okay, we're developing green HTA capacity in HITAP, maybe in other HTA bodies across Asia and the world. But how can we make this more understandable, more appealing to the decision makers,
Right.
to the ministers of health, to the purchasers of healthcare, the PhilHealths and the National Health Security Offices of the world?
Right. That's the biggest challenge, right? And from HITAP's experience trying to use HTA in decision making over the last 15 or 20 odd years, doing the technical bits is not that important if the decision makers aren't willing to use it. So what one of our core work at HITAP is to sensitize these technical things to end users, and that includes clinicians and patients and decision makers. So we do regular trainings. It's a layman training to speak with them. Okay, this is what is available. If you use this, these are the savings that you can have. So you show them the benefits that they can accrue by using these tools. And the training is one big part. The other part is institutionalizing decision making. So Thailand picked up HTA a long time ago, but countries like the Philippines, right? The PhilHealth recent establishment, even Singapore, ACE is only 10 years old. And many countries in Southeast Asia and Africa, what we primarily do is we try to target ministries of health or the insurance bodies and try to sensitize them about these kind of tools.
Any questions from the room?
Can I quickly just...
Please.
Yeah, so brilliant presentation, by the way, very, very interesting. So you mentioned about redefining values, right? And I think, naturally, until we hold the same outcome or the benchmarks for the same outcome, such as cost, time saved and all that, the appeal of having a more sustainable solution may not be at the most priority for most stakeholders. So I was just wondering what, or rather how would you suggest that we can interest or convince the stakeholders to redefine their values so that this whole conversation is more meaningful to them, and so like sustainability is actually taken part of the consideration in the outcomes.
Great question, and the person who should be answering this question is right next to me.
Oh my God.
Right? I mean, this is
a bit philosophical.
Yeah, philosophical. Like you're asking stakeholders to change what they value, right? And that's the work that Renzo and the team here and yourself are doing, right? You're trying to make sure that planetary health is part of the value metric in decisions day to day or political. So I think, yeah, it's a much bigger question, much broader question than just HTA.
Right. Because actually, even from the advanced questions, a few questions were hinting at this question. There's a lot of questions, right? Whether environmental sustainability for now is more of an addition,
right,
to our definition of what's value in health or value in healthcare or value in health in general, or is it an intrinsic part of when we say it's good healthcare because it's good for the planet as well?
I go back to your point, right, about the cyclical nature of this impact, right? There is human activity, and it's causing climate change. That is causing a lot of sickness in us. We go to the hospital. Our hospital procedures are causing a lot of greenhouse gas emissions or environmental impact, and that is in turn causing us to be sick again. So this cyclical loop is just going on and on and on and on. And there's economic cost, there's health burden, there's environmental damage. So it's no longer a question of whether this should be an additional or just a side piece, because this is directly affecting the whole system.
Yep.
Right? It's a core part of the system. So if you're trying to address the system, this has to be a one of the key part, if not central. Yeah. In terms of like, if I go back to your question, how do you convince decision makers? And there are various things like push and pull factors, right? There's at the national level or international level, there's the net zero. Many countries have already pledged, over like 100 or 150 countries have pledged. So in Thailand, the health sector is also part of it. And for us, it becomes very easy to push this agenda because their goal is also become net zero. And this activity contributes to net zero. If you think the examples that I showed earlier, at the very individual level, even if you don't care about the environment, you can have economic savings, right? So if you care about finance, if your decision maker cares about dollars, just show them and do this, and you can save money. But by doing this, you can also show additional goodies, right?
Yeah.
Environmental savings. So you can use like what they value to
As an entry point,
Yeah,
and
yeah.
then you present also
Exactly,
the
yeah.
environmental benefits. Thank you so much. I'm reminded of another innovation in economic evaluation, the extended cost effectiveness analysis,
Yeah.
because they're adding equity,
Yeah.
right? Where is equity now in the green HTA process?
More complex. It's become more complex, right? Actually, like a month ago, when we were presenting this in Bali, one of the question I got is quite similar. They said like, okay, in the past you had cost and outcome,
Correct.
and then now you said like, okay, this is not enough. Now you need to add equity. Then you have an additional indicator. Now you're telling me I need to add green HTA as well. Now, which one should I believe? And which one should I use? And if I'm going to use all of it into one, how can I actually use it?
They give weights.
Yeah, exactly. Yeah. So that's why I mentioned earlier that MCDA, right? We may not have we may not reach a point where we will have a single metric to say whether this captures the overall value of our society. We methodologically we're not there, so we can use MCDA as a means to get there. And like you said, different stakeholders value different things at different levels. So MCDA allows everyone to capture that.
There's one question which somehow you touched. Basically, are we also taking into account the emissions, the environmental impacts through the entire life cycle, even from the extraction of the metals,
Right.
the minerals used, right? I guess one question is, where do we set the boundaries?
Yeah.
Right?
Great question, and that's why we mentioned earlier that this is not only the health sector's responsibility or health sector's problem. This is an intersectoral and actually even like cross-national boundary problem, right? If you think about greenhouse gas emissions, it has no boundary. It does not care about borders. So yeah, you're right. It's very difficult to define boundaries in these cases. But to your first question, in an ideal case, you should try to do from the point that it's being extracted from Earth all the way to it goes back to Earth.
Cradle to grave,
Cradle
as
to
you
grave.
mentioned. Is there a potential for the green HTA to also reshape the pharmaceutical sector, the big pharma? Because usually we do HTA to inform decision making in purchasing, right? What's included in the benefit package, for example.
Right.
But how about the suppliers,
Right.
the manufacturers?
Fantastic question. And you answered the question yourself earlier about like dialysis, right? Can we think about sustainable practices? The energy used from dialysis is quite high, but can we green the energy system, right? So we are hoping that we can push the pharma, the medtech industry to change their practice, not only in terms of like how things are developed, but also what do they develop. And in Europe, there's a group of scientists who have written to EU European Commission to at the very minimum they should report the environmental impact of their individual products during registration. So that's a good start, and hopefully from that we can take it backwards and affect what they produce.
Awesome. We have 4 minutes remaining, and we will wrap up. And maybe my last question is, what advice, or is there an ask that you can give or tell to, 1, the research community, because we have researchers listening, 2, policymakers,
Right.
and then 3, the clinicians, because we have clinicians from across the Sing health system listening.
Right. Good question. I'd like to go with clinicians first.
Sure.
Because our team, we've been wanting to do this for a while. We want to work with clinicians because, as you saw with the case of anesthetic gases, they are the decision makers.
Sure.
They can actually make very tangible change without the need of their healthcare executives or the policymakers saying anything. They are the key decision makers.
And we don't want to remove their decision-making power.
No, we just want to empower them.
Good.
Right? Just give them the information they need. And like you said, if there's a trade-off between environment and health, majority of us, and we should prioritize health. But to clinicians I would say there's a growing community even in Singapore, and try to see if if there are sustainable alternatives, and see if you can try and test. If you want to do some experiments, so we're happy to do it, because I'm really interested to see to do some experiments within the hospital setting, similar to the anesthetic gases. To researchers, I would say
Do more research.
and do more research, collaborate with us. There are a bunch of trainings now. This is an increasing space. Try to look out for more. Policymakers, I would say, try to broaden your value. I know they do, but exam US, other countries are still keeping climate change and environment a big priority.
Right. And I think for the researchers, apart from doing more research, right, we need to be open to transdisciplinary research, as you have been invoking. And also, once we have the findings, how do we communicate this?
Right.
That's also the next challenge.
You're right. As researchers, we tend to get boxed in, and we care so much about our numbers and models
and throw the jargons.
And then there's the clinicians and the decision makers that are having absolutely no sense of what gets presented. So it's absolutely vital. As much as you should focus on the technical side, you should try to simplify and hit the messages home to key stakeholders. Otherwise, your efforts are just lost.
Great. Well, let's give a big hand again to Sarin. Thank you so much. And thank you also to our participants, both in this room and in Zoom. And we just had another very rich and meaningful Conversations in Planetary Health. Please join us in our next episode on September 16. And this is very important. I think this is also the missing part of the this movement, right? And maybe you're already starting to think about it. Our next episode is entitled Patient Voices for Planetary Health, which is a very important, if not the most important perspective that needs to be considered in this conversation. So again, thank you everyone. Stay safe and see you in our next conversation. Goodbye.